So hello there, everyone, and thank you for tuning into our presentation. My name is Monika Volz, and these are my colleagues Bethany Rogers, Gabriela Mineva, and Dana Pearl. We are all third-year UL Gen students, and we are here to present our research on access to general practice healthcare during the COVID-19 pandemic and the Irish adult population who use social media. Next slide. So in Ireland to date, there have been around 230,000 cases and 4,085 deaths due to COVID. During these times of lockdown and isolation, there has been a significant change in the healthcare system. Movements to telemedicine, video consults, and electronic prescriptions have increasingly become adopted. The COVID-19 pandemic has certainly placed a strain on the healthcare system, as we all experienced while in GP placement last semester, and we thought it was thus important to determine which barriers contribute most to obtaining or not obtaining medical treatment. Likewise, gaining knowledge into the types of appointments being missed will provide insight into the areas of medical care that need greater attention once resumption of regularly scheduled appointments occurs, especially in general practice where screening and referral services originate. Therefore, this study aims to identify which barriers are the most important in accessing general practice services among the Irish general population, and then furthermore, what types of medical appointments are the most affected. Next slide. So we developed an anonymous 25-question online survey using Qualtrics software. Our inclusion criteria included Irish adults 18 or over who tried contacting their GP since March, and we excluded people under the age of 18, prison inmates, people with a mental disability, non-English speakers, and people who did not attempt to contact their GP in the last 6 months. Then we also gained ethical approval. Next slide. So we distributed our survey on social media between October of 2020 and February of 2021. We received 649 responses using Qualtrics, and we did a quantitative analysis using Excel and a qualitative analysis using a methodical sorting scheme. Next slide. So going into our results, our first results table is a demographics table. So we noticed that the majority of the responses obtained were from women, people ages 25 to 54, and people with a bachelor's degree, and also people living in Munster. So now I will pass it along to Gabby Mineva.
Perfect, thanks, Monika. So initially, we wanted to gain a bit of perspective of our cohort, and one of those two areas was the medical coverage that was available to our participants. And we did know the majority of them were under private or pay out of pocket with 444 results, and several with the public scheme, 172, and a couple just on the doctor visit card. And we wanted to see prior to COVID-19 how many times per year people had visited their GP, and the most responses were noted in kind of that once, only a few times per year, or every 3 months or so, so not too often. And next, we wanted to determine if the COVID-19 pandemic had caused cancellation for appointments. And surprisingly, most of the responses had noted no, and a few that had noted yes, with 140 responses. Those were, majority of them were canceled by the GP or the practice nurse, with 120 responses. And various reasons were noted for patient canceled appointments, such as unable to contact their GP, or personal fear of the precautions as well, or just being in self-isolation. And next, we wanted to determine if those canceled appointments were indeed rescheduled, and most people had noted that they were not, with 504, and a few that had noted that they were rescheduled, 116 responses. And of those who were rescheduled, we wanted to note who was rescheduling them, and those were the GP or the practice nurse with the majority of the votes. And when patients were canceling or rescheduling themselves, they were just various reasons kind of all over the map. And we wanted to note a few of the common types of appointments rescheduled, and most of them were a new health concern. We had a few blood test rescheduling as well, and regular medication review, and just a couple more outlined there. And just to note that most of them had noted not applicable because they were not scheduled, rescheduled, or canceled.
Hi, so I'll take over from here. So we thought it'd be interesting to ask our participants if there had been any disruptions in their medication regime. So around 20% of respondents to this question said that there were. And then when we asked reasons for this, the majority of people stated that their GP did not renew their prescription, with the following responses: I did not renew the prescription, or that the pharmacy was unable to obtain the medication being the second and third most responded. So we then thought it would be interesting to ask the respondents to our survey what type of appointments they were having during the COVID pandemic. So the majority of people responded by saying that they had phone conversations, with in-person consultations being the second most. Of note, video consultations were far less popular, and then many were not applicable as well. We also thought it would be interesting, as we've noted in the results so far, to inquire if any of our participants had sought medical advice from sources outside of their GP during the pandemic. So interestingly, about half of the respondents said that they did seek medical advice, with HSE websites, Google, and on-call doctors being the most popular choices to look for this type of medical advice. So we thought it'd be interesting as well to ask about how the respondents were satisfied with both the length of the appointments and the number of appointments they received. So surprisingly, most patients were actually quite satisfied, with nearly 50% with both of these questions, not satisfied being the next most popular, and then some were both somewhat satisfied and unsure.
Great.
Switch over to you now, Bethany.
Makes sense, yeah. When looking at the comments left by respondents, we divided them up into both positive and negative, with the majority actually being negative comments. Of those negative comments, the most commonly seen were issues contacting the GP, as well as issues with the perceived quality of care, and then issues with being denied appointments. And we'll just skip to the next slide then. Next slide, please. Oh, there we go, thank you. So I'm looking at the positive comments. The most frequently seen there were actually happiness with the quality of care being received, as well as having a preference for the phone consultations. And we'll go to the next slide, please. So though our data is in the preliminary stages of analysis, some trends have started to emerge. For example, as other studies have also seen, fear of contracting COVID-19 has been a major deterrent in accessing GP services. As well, another common theme we saw was that contacting the GP surgery in order to book appointments was a major issue throughout the pandemic. Of respondents who had their appointments canceled, the major source of this cancellation was directly from the GP surgery. This can lend some insight into the increased pressures that healthcare providers have faced throughout this pandemic. This can also be reflected in the fact that the major source of prescription renewal issues again came directly from the GP surgery, as well as the fact that on-call medical services was the third most common source of medical advice sought by our respondents in this survey. Just to again note that the top 3 appointments to be missed were new health concerns, blood tests, and regular medication reviews. This can lend insight into the types of appointments that may need to be focused on moving forward once medical services kind of regain their full capacity kind of pre-COVID times. And then just to note some shortcomings of this survey. So first of all, the survey was circulated online via social media. So there, of course, is a potential to miss the older population responding. And we did indeed see that, where 3% of our respondents were over the age of 65. As well, there was surprisingly an unequal gender distribution, where the majority were female and from Munster. And then also just need to consider the response bias here, where individuals who have a stronger opinion on something are more likely to leave comments, which indeed we did see with our comment section being 74% negative comments, so kind of that dynamic there. And let's go on to the next slide, please, with Dana closing us off.
So as we're still in the preliminary stages of data analysis, and as Bethany said, just determining the trends that are emerging, we thought it would be kind of helpful to include a few of our preliminary recommendations to the health service. So areas to focus on would be specifically GP follow-up required for all of these missed appointments, as many of the respondents had indicated that they had missed appointments. And then we thought it would also be important to design a safety net in order to catch the patients that are likely to fall through the cracks. Specifically with things like medical prescriptions, maybe if there could be some sort of alert service in order to alert both the patient and practitioner that medications are to be under review. As well, to make telemedicine software easy for the elderly. As we saw, video consultations were very few and far between, but if we could potentially make that easier for people to use, that could be another access point. As well, home visits and regular check-ins are important for those who are still self-isolating and will be unable to come in person. And then both to bolster the on-call and out-of-hours doctors, as they were a main source of medical advice during this time. We also think it'd be important to prioritize patients who have missed screening tests, such as cervical and breast checks, as that could cause very severe potential complications down the line. And as well, we thought that public education and clear messaging about who to contact and when to contact when you feel sick, and that it's still safe to do so. So that brings us to the end of our presentation. Thank you so much. Please let us know if you have any questions, and we also have some references as well.
Thank you very much. Very good job at preparing that presentation as a team with everyone having a voice. So congratulations